We'll get through a little bit more of this. I will give you a brief review of what to expect on your test next Tuesday as well. And then I'll let you guys have some study time for that big exam you have later today. Sound good? All right. So we left off talking about fluoroscopy, guys. Just to go back one slide, make sure once again that you've written these two number ranges down, both creatinine levels and BUN levels. When we're talking about urinary procedures, whether it's X-ray, CT, MRI, or whatever, this is a very important set of numbers with a big star on, because very likely you'll get at least one of these on your registry. They love to ask questions on those right there. And, you know, put it in that permanent memory bank if you go into other modalities, because they'll ask it to you again and again and again. Very important number ranges. You will see questions on this from me and likely on your registry. So make sure you memorize those numbers right there in the big, bold red. It's one of those things I write down immediately before I start my test on my scratch paper. That's what I've always done before my registries, write those numbers down, because I'm terrible at remembering numbers. So talking about your responsibilities, guys, most of you know this already, but of course, going back to aided patient care, of course, you want that good, thorough patient history. Very important when we're doing any kind of fluoro procedure, especially in the urinary types of fluoro procedures, because of the higher amount of risk associated with introducing contrast into the urinary system. Allergies are a little more prominent overall, and as you guys remember, when we're talking about doing catheterization procedures, most of your urinary procedures are catheter-based. And if you remember, when it comes to catheters, that's the most frequent source of infection in patients. That's all the way back to patient care, but a very important point to remember. Dealing with the urinary system, in particular with catheters, Foley catheters to be more specific, is the most frequently infected area of the human body when we're inserting those catheters into the urinary system via Foley catheters. Write that down, remember that, please. Hint, hint. So also, selection and preparation of the contrast media, guys, should go without saying, but people don't do this because they get in a hurry. Make sure you read that label several times. Make sure you confirm with the radiologist that you're using the correct contrast medium. Don't just make the assumption that you know the best contrast medium to use because you use it on everybody else. Because once again, we talk about allergies in the urinary system, UTIs, urinary tract infections, just infections in the urinary system, period, are so much more frequent. Allergies are much more frequent. We want to make sure we're using the correct contrast medium every time. So read it several times, confirm with the doctor, write yourself a note, always about document everything you do, just in case they come back and say, well, I didn't tell you that. Well, yes, you did. I got it documented right there on the sheets. Cover your tracks, because people often have allergic reactions to these procedures. And have an empty container available, especially if they start urinating on themselves. You want to have a bedpan, something to catch that urine, because dealing with urinary tract infections, urinary procedures, incontinence, people lose control of their urinary system. You want to have something to catch that. And of course, lots of towels nearby to clean up any mess that might occur. Depending on the type of exam you do, we frequently, at least where I used to work, we have the patient actually pee on the table. You actually have them pee on the table during these urinary studies because they want to watch the urine coming out filled with contrast, make sure everything's working correctly. So it goes without saying, have empty containers, have towels, have wash rags, have a lot of stuff available to you, because it's going to be a messy procedure. What we'd always do is we'd always surround the kid with towels and washcloths. That way when they pee on the table, it's going to absorb it all very easily. But yes, they do it for adults as well. They'll have them actually urinate on the table and watch the urine come out filled with contrast. I see y'all making some faces. Yeah, that's true. You actually have them pee on the table. It's part of the procedure. Y'all haven't seen that yet? You will, depending on where you work. Okay, of course, once again, patient history, guys, selection of their contrast media, reading that label several times. Make sure that your emergency cart, of course, is fully stocked, and especially with urinary procedures, because of the frequency of allergies. Again, you want to make sure there is epinephrine available in case there is an allergic reaction to that contrast during a urinary procedure. Also, the cardiopulmonary resuscitation equipment. Most of your crash carts should always have this on there. I know some of the crash carts you guys frequent do not, but technically speaking, a crash cart should always have a set of paddles on it that work. That's why we test it every day. Have y'all seen a few crash carts missing that? I've seen a few through Harris Health that are missing that. They should not be missing that. It's not a proper crash cart. Should always have epinephrine, should always have the shock paddles, everything ready to go in case the person has cardiac arrest, and should always have oxygen and suction available. Otherwise, that is not a proper crash cart. They should not be legally signing off on that. Keep that in mind. Keep that in mind wherever you work. Most of your facilities are going to be really good about that, but I've noticed a few around Harris Health missing some of those supplies. That should not be happening. Typically colored red or blue. Most are colored red. They'll be colored blue as well. You have those little drawers on there. Make sure, when you start working, guys, make sure you know what's in each of these drawers. Take it seriously that you stock those supplies. I've seen people get really lazy. Something would happen during a case where a patient would start crashing. They'd open up one of those drawers, it'd be empty, not have the supplies in there. And guess who gets in really big trouble? You do. You do. Even though probably the shift before you was supposed to have checked that, you always want to follow up and be thorough. And at least where I worked, we would do checks twice per shift. Make sure everything was supplied and would sign our names off on it.
The doors of your cells are locked, so you can't open them and look at the doors.
Are they locked, really?
They don't stop them, right? They say they don't stop themselves, but they call someone in the case every time.
What good's that going to do if something happens? That's
I think it's like a break, like a.
It's like a breakable lock.
open it.
Like,
Yeah.
okay,
Yeah,
okay,
yeah.
then you're good.
But
Then
I
you're
felt
good.
like the breakable, well, I think for a word.
They're doing like with a key. It was
It'll be
like,
the pharmacy to go check every month, so the radiology's job is to just have it there and make sure it's not broken, basically, and make sure the suction is working. But the pharmacy job is for us to go in there, break it, take it out, check expirations. We bring a card, and that way we're responsible of the drugs.
I was just thinking in my head, I was like, wow, they haven't blocked the key. I'm like, I think of the patient having cardiac arrest. I'm like, well, does anybody got the key? That'd be an awkward situation. Breakable locks, that's good. I have fun, well, not really fun memories of these crash carts. I just remember every night at 4 o'clock in the morning, I would check that crash cart because I was working the night shift on weekends. I always, directly at 4 o'clock in the morning, walk over there, run little test strips and sign off on it until they quit letting us do it. They apparently had too many issues, just what I'm speaking of. I'm not sure if they still do it over there at TCH, but whenever I left, we weren't allowed to check these anymore because too many people were slacking at the job, not doing it properly. They didn't have the proper supplies or the equipment didn't work, and they actually gave that to the nursing staff to come by and sign off on and check it every shift. So we lost our privilege to do that.
I'm sure they were happy about doing that.
I'm sure they were. Nursing wants to take over everything. They're more than happy. Okay, so pre-medication protocols for our urinary procedure, guys. We want to give a combination of Benadryl and prednisone over a period of 12 or more hours before the procedure. And patients who have a history of hay fever, asthma, food allergies, previous contrast media reactions are going to be candidates for that pre-medication procedure. And that's the medication we are going to give them if you do have any of those allergies. That's that Benadryl and prednisone. Make sure you remember those two medications. 12 or more hours before the procedure. That's the same Benadryl you can get over the counter. Don't be one of those parents that says, oh, my kid won't sleep, I just give him a Benadryl and put him to sleep. I've heard so many parents say that. Don't be one of those parents. Because Benadryl will knock you out. So I always think of that when I hear Benadryl. I always think about parents saying, oh, I just give my kid a Benadryl at night, puts him to sleep. What's the matter with you? I'm sorry, I'm still writing.
So is this, so it says patients with the history, with these histories are candidates for the pre-medication procedure. So it's not everybody.
Not everybody. So yeah, let me make that clear, guys. Probably not the best order of these bullet points. These medications are for the patients that have these types of histories right here. You're not going to give that to every patient, just the ones that present with asthma, food allergies, contrast reactions, or hay fever. It's specifically for them, so you can still have that procedure done. So, I mean, a lot of us have food allergies. I have food allergies. I'm lactose intolerant. That's very common sicknesses that most people have. All right, so our categories of contrast media reactions. This goes all the way back to methods of patient care. Kind of a cyclical nature here. Some of this information we're reiterating. Great review. Make sure you know the difference between reactions. We're going to go through the moderate, severe, and minor reactions as well. You do need to know all these specific reactions. they're going to ask you questions on at least one of the categories of reactions. It's a guaranteed question you're going to receive. It goes back to patient care, and they're really hitting patient care very, very hard on your registry. So a local reaction, that's going to be a reaction that is specific to a region of the body. Systemic is going to be a reaction to the entire body or an organ system, thus the word systemic. Systemic means a broad range. Local is a single specific area. For example, if my arm got really red and blotchy, like I was having hives, that's a local reaction. If my entire body swelled up like a balloon, that's systemic. Or if my organ system shut down, that would also be systemic. Have that taste in your mouth, that's a local reaction, that mallet taste. Specific versus entire body and system. Here is our mild reactions, guys. Now, a mild reaction is defined as a non-allergic reaction that does not typically require drug intervention or medical assistance. This is what we typically expect to happen in most of our patients. So if you're going to have a reaction, these are the ones we actually want to have because they're very mild, they're not going to be severe, and they're things that we can deal with very easily. And that's going to include, a lot of people don't realize, anxiety. Anxiety is a mild reaction to contrast mediums. Not just because you're an anxious person, anxiety is an actual reaction. Lightheadedness, nausea and vomiting, that metallic taste, which I put as the most common side effect because almost every patient that has a procedure done in the urinary system always says I have a metallic taste in my mouth. That's the most common reaction you'll see. Mild erythema, that is turning red, flushing all over, very common. That warm flush sensation during injection, it's probably our most second common side effect, is feeling really warm all over. And itching and those mild scattered hives. All these once again are very mild, these are expected. We don't mind if these happen because they're not going to be life-threatening or dangerous. So if your patient complains of any of these, it doesn't mean you have to go hit the code button. Just tell them it's all right, it's normal to have that reaction, just relax, it will subside in a few minutes. So if your patient starts turning red, don't freak out, that's normal. They start itching, don't freak out, that's normal. They say they want to punch you in the face because they're in anxiety, don't worry, that's normal. Normal side effect. Just duck out of the way if they start to punch at you, but in that case, probably let somebody know. That's secure enough for trying to hit you, but anxiety actually is a very overlooked reaction when it comes to contrast mediums. It's been a proven side effect. That's why a lot of your patients get uncooperative during fluoro procedures. So a likely type of question you'll get on these 3 slides I'm about to show you is going to be a multi-choice answer, because I got to get y'all used to those multi-choice answers. They'll say select all that apply. Which of the following are considered mild reactions? You have a list that you have to select from. Just a warning.
Would you be
I'll just have these select all that apply. So unfortunately, the registry will not number those questions. They'll say select all that apply and leave it at that. I'm not going to say select 4, select 3. I'll say select all that apply. Unfortunately, I hate those kind of questions too. But we got to train to do them. All right, moderate reactions, guys. These are what we consider a true allergic reaction. We're getting a little more serious here. These are things we actually do not want to happen, and if they do occur, we got to apply the proper treatment to help these subside quickly because they can develop to a severe reaction. So a true allergic reaction can also be termed, let me say that again, I can't talk. A true allergic reaction can also be termed an anaphylactic reaction. I'm sure you know that terminology as well. And the most common symptoms we're going to see are urticaria, that's going to be moderate to severe hives, laryngeal swelling. If you see their neck swelling up, that's a moderate reaction. You want to take that seriously. Of all the things that can happen, watch for that neck to swell because that happens quite often on these allergic reactions. Bronchospasms, tachycardia, bradycardia. Tachycardia would be the fast heartbeat, bradycardia the slow heartbeats. Angioedema and hypotension. It's going to be our most common moderate reactions on these urinary procedures, and the ones, once again, we want to take more seriously because they can develop into those severe reactions. These are true allergic reactions, also termed anaphylactic reactions. All right, and then of course we're going to go into those severe, also called vasovagal reactions. Severe and vasovagal mean the same thing. These are going to be our life-threatening reactions. The most serious, obviously, with the word severe in there, would be the most serious. And that's going to include hypotension. That's when our systolic blood pressure is less than 80 millimeters of mercury. Bradycardia, that's going to be less than 50 beats a minute. Our cardiac arrhythmias, that laryngeal swelling continuing can turn to that severe reaction. Convulsions, I've seen patients convulse during these contrast procedures. That's a very serious reaction. They actually seize up. A loss of consciousness, cardiac arrest, respiratory arrest, and of course no detectable pulse. Those are all going to be our severe vasovagal reactions to contrast media. Make sure you know the difference between those three categories, as well as how to select those from a list. Now, obviously, I'm not going to give you something like laryngeal swelling, because that's considered both moderate and severe. That'd be a little unfair to ask that one. But the rest are pretty fair to select. I guess I should probably say severe laryngeal swelling to be more specific, but it does fall under both those categories of moderate and severe. This is why all our patients sign waivers before contrast procedures. If you ever notice, you always have patients sign a little sheet before contrast procedures, because even if you're a healthy human being, there's always that small chance that any of this stuff can happen to you. If I had my procedure a week ago, they had me sign like 3,000 documents. Oh, you could die from this, or this could happen. You could have this, that. And all right, sure, whatever. But there's always a chance for everything to happen, no matter how healthy you are. But that's why we have you sign it, so you can't sue if it does happen. All right, so we're going to go over some clinical indications and pathology. We'll go over these, and this is where we'll end today before we get to positioning. So, right in the tunnel here, hang with me. So, contraindications, why we would not want to perform an IVU, or you can even add to that a urinary contrast procedure. That's going to be, number one, the most common contraindication we're going to have is that hypersensitivity to iodinated contrast media. We definitely would not do that procedure if that's the case. Anorrhea, multiple myeloma, diabetes specifically and especially diabetes mellitus, hepatic or renal diseases, we do not want to do these procedures, can actually cause a patient to die. Congestive heart failure, pheochromocytoma is a tumor of the renal system. Pheochromocytoma is a tumor of the renal system. We would not do those procedures. Sickle cell anemia and renal failure, whether it's acute or chronic. These are the 9 contraindications of why we would not do a urinary contrast procedure. Once again, the most common of those 9 is going to be that hypersensitivity to iodinated contrast media. Some clinical indications, and we're going to go over each of these individually, show you what they look like. Some of our clinical indications for these procedures are going to be benign prostatic hyperplasia, bladder carcinomas, our congenital anomalies, which are quite common when we talk about pediatrics. That includes duplications, horseshoe kidneys, and malrotation. Malrotation, probably the most common of those 3. I've seen a million of those. Cystitis, our polycystic kidney disease, our renal calculi, which is the official term for kidney stones, and renal obstructions, particularly hydronephrosis. Next time, we'll show you what each of these look like here. We're going to break them all down. Anyone heard them throw that term around, malrotation? Flora? Very common anomaly of the kidneys. dozens of those. It's a very common birth defect, malrotations. So benign prostatic hyperplasia is defined simply as a swollen prostate that is obstructing the urethra. A swollen prostate that obstructs the urethra and will prevent that urine from flowing properly without pain. Very painful. It's usually related to prostate cancer. It can also be benign, as it says in the word right there. That's going to be a swollen prostate that's obstructing urine flow and causing painful urination. Very common disease. A lot of males develop that. That's why they get the prostates checked when you reach a certain age. So as you get older, guys, if you ever have trouble urinating, go get that checked out. It's usually a common cause for that. All right, duplications. Duplications are a birth defect of the kidneys, wherein one kidney is literally duplicated and conjoined. So right here we have a kidney with two renal pelvises, two sets of calyces. It is a very enlarged kidney. There's a duplication of a single kidney that is connected on the same side. Duplication of a single kidney is on the same side. They typically present with two renal pelvises, two sets of ureters, two sets of calyces, two sets of nephrons. It's literally, within the name, it's a duplication of the kidney, and it's conjoined. A person can actually live with this normally. So this person, as you can see, has three sets of ureters. Three ureters. This one on the left up here actually has four. There's triple duplication up here.
They all function.
They can all function.
Does it function more efficiently?
Just from what I've seen, it's just pretty normal. It doesn't really make a big difference. The only time it would be dangerous is if, let's say, it really became deformed in development and it caused an obstruction to develop fully. But most that I've seen on kids, they function just normal. Doesn't increase the rate of urination. Just it's an extra ureter, extra kidney in there.
Extra backup plan.
Extra backup plan. There you go. Yeah.
You can have another beer.
What'd you say?
So you can have another beer.
Have another beer. There you go. Horseshoe kidney. Horseshoe kidney is when our right and left kidney actually conjoin in the middle. It forms a literal horseshoe shape, which you see right here. This can be a little more serious because this can actually interfere with the actual filtering of urine. And typically they're going to go in there and go ahead and split those apart. A few cases I've seen, kids have functioned normal with a horseshoe kidney, but most often they have to go in there and get that fixed because that can cause a lot of issues they develop. That's a CT of that horseshoe kidney. You can see how it looks very cystic. This is a very severe case, but like I said, I have seen some where they're actually completely normal, but most of the time they go in there and surgically split those apart. This can be our horseshoe kidney. The right and left kidney are conjoined in the middle, forming a horseshoe shape.
Mr. Donkey?
Yes.
For the duplication of the uter, can it be removed?
For the duplication of the,
Of the uter?
can it be removed? It can be. They can completely remove that extra one and just have two, but a lot of times, like I've said, like at least I've seen in my experience, they just leave it as is because it doesn't seem to cause any issues if it's functioning properly. If it didn't develop fully, like I was talking about a second ago, they'll go ahead and probably just remove it and keep them with the normal two. Pretty neat to see. Pretty interesting to watch when you're doing those fluoro studies. Malrotation, this is the one that I saw the most when I used to work. Malrotation is literally a rotated kidney. And what I'm talking about is Most of the time, your kidneys are right here with the pelvis. This has two renal pelvises facing the same direction on both sides. So this pelvis is facing the left, this pelvis is facing the left. Literally like the kidney twists, and they're both facing the same direction. This can cause the ureters to constrict and become blocked. So this is a more serious condition. It's a major birth defect, and you usually go in there and fix that right away, because typically most of the kids that present with malrotation only have one functioning kidney. So you got to fix that twisting of the kidney and put it in the normal direction so that urine flow can continue as intended. So malrotation is really a rotated, twisted kidney that can cause constricture of the ureter and prevent proper urine flow and filtering. And we have a lot of these. Very common birth defect. Cystitis, every time you see the word itis, you should always think, what? Swelling. Cystitis is really a swollen bladder. Simple, to the point. Swollen bladder that can actually constrict your urine flow, depending on the degree of swelling. Swollen, inflamed bladder is what it looks like under a microscope. Very similar to colitis, gastritis, or like ulcerative colitis, where you have those ulcers and swelling and red spots on the organ. Just this is dealing with the bladder. Cause a lot of pain when you're trying to urinate, obviously. All right, polycystic kidney disease. This is another very common issue that we see a lot of. This is the formation of cysts on the kidney, causing the entire kidney to usually double in size, become extremely infected. And these cysts can actually rupture and burst and cause a lot of infection throughout the body if it's not treated quickly. This is what it's going to look like on a CT. You can see how large those kidneys are. They should be probably a third of this size on a CT. This is a very advanced case. And like I said, these have a danger of actually bursting and causing a lot of extreme infection within the body if they were to explode. That would be your normal kidney size. This would be an advanced polycystic kidney. Breaking down the word multiple cysts kidney, polycystic kidney, multiple cysts on the kidney. Here's the one most of us know about right here, the renal calculi. Renal calculi is the scientific term for kidney stones. You probably have seen a million of these on your KUBs you've done. There's little white spots in the bladder or close to the kidneys. Very common thing that happens to a lot of people. Luckily, these days with the advanced technology, if someone does have a very large kidney stone, they can go there with a lithotripsy and break that apart. Hopefully before it gets to this point right here, because these two KUBs, this person is probably on the floor, barely able to move. That's an obstruction of a kidney stone. And if you look at the shape of these things, they come in all shapes and sizes, but the most common is this shape right here, where they're actually spiky. And they always say as you're passing that kidney stone from the kidney to the ureter, it's tearing at your ureters as it goes down. And then of course, if you pass it through your urethra, you can use your imagination there of how painful that would be as well, because it's tearing at the urethra as you pass it. So if you ever suspect that you have a kidney stone, go in and get that fixed, get that thing reduced to powder, get a lithotripsy done, so you don't have to go through that pain. 'Cause I hear it's worse than childbirth. I've never had a kidney stone, but people I've known that had kidney stones say it's the worst pain imaginable trying to pass those things. You have a question, Javier?
Yeah, I don't know if this is a dumb question, but like, can that
No such thing.
rupture the urethra?
It can tear a hole in it, yes. Yes, it can. No such thing as a dumb question, Javier, don't say that. And you can see, guys, they get really big. Look how big these are. I mean, this obviously won't even pass out the kidney. It's going to be completely lodged. So it can be very, very serious. At least from what I've been told, if you're prone to drinking a lot of sodas, you're more prone to having kidney stones. I don't know how true that is, but that's what I've always been told. The more sodas you drink, the more likely you are to have kidney stones as you get older. So get off the sodas. I got off sodas a long time ago. Just have them every once in a while. And then finally, guys, we have what's called hydronephrosis, another birth defect most commonly found in infants. Hydronephrosis is when the renal pelvis swells and takes up almost the entirety of the kidney, which you see right here. Here's the normal size of a renal pelvis with the calyces. Here is the birth defect where it swells and basically takes up the entirety of that kidney. Causes a lot of major issues because filtering will not take place properly. This baby here has a reduced number of nephrons because the majority of that kidney is pelvis and calyces. So the filtering process would not work properly. They'd have to go in there and either remove the kidney or try to reduce the size of that pelvis. I've seen most of the time they just end up probably removing that kidney because it's not functioning properly anyway. And you can't live with one kidney. That's why a lot of people donate their kidneys. Which part? Yeah, so hydronephrosis is when the renal pelvis and the calyces swell and take up the majority of the kidney. The kidney cannot function properly, cannot filter urine properly, and typically they're going to have to go ahead and remove that kidney. Sometimes they can fix it, but most of the time they just go ahead and remove the kidney, and we can function properly with one kidney. We can live with one kidney. But a lot of people donate them. All right, and that's where we're going to stop today, guys. I don't want to get too far ahead. So we're going to stop for Lab Code 4 on this slide and pick that up on Tuesday. But now I'm going to go ahead and pull up another PowerPoint for you guys to show you guys